Onset of winters evoke mixed reactions. Some people like it and others don't. Friends, you might have noticed upswing of heart attacks and strokes in your locality and acquaintances during winter season. Hello, I am Dr. Madhur Jain and I am a heart specialist. I am working with Park Group of Hospitals, which is the fastest group of super specialty hospitals in North India. Actually, it happens due to temperature drop in surroundings that impacts body's physiology or normal functioning. Scientific researchers have found nearly 31 to 33% more heart attacks and nearly up to 11% more stroke cases during winters. As temperature drop, the blood vessels in our body tightens or in scientific language constrict and blood flow speeds up in order to travel around the body to help us stay warm. So our heart has to really work harder to push blood against these constricted blood vessels. That's why the blood pressure often remains higher in winter season. Blood vessels of the brain also constrict, which can precipitate the onset of stroke. Blood vessels of heart can constrict during winter, which, along with increased workload on heart and higher blood pressure, can lead to poor supply of blood to our heart muscles, which can precipitate heart attack. In summers, we lose water through sweat, which is missing in winter. So, increased fluid content in our body in winters can lead to increased salt and fluid retention, which again can lead to increase in blood pressure, heart failure, and heart attacks. Because of changes in chemical and hormonal balance during winters, including cholesterol levels and increased in level of clotting factors. And also the platelets tend to stick more in winters. This, along with already constricted blood vessels, can lead to increased tendency for clot formation and thereby heart attacks and strokes. Tendency to stay indoors, increased food and calorie intake, and decreased physical activity can induce physical changes in the form of weight gain, which again is a risk factor for heart attacks and strokes, along with others. Ambient air pollution adds to all these risks. Being indoors, vitamin D deficiency is also common in winters, which can indirectly contribute to the risk. Elderly, alcoholics, smokers, and people with sedentary lifestyles are more at risk. To reduce the increased risk of heart attack and strokes in winters, you should reduce your exposure to cold. Follow healthy eating habits. Stay away from smoke and alcohol as much as possible. Go for regular physical activity and follow up with your doctor for a routine health checkup and a review of ongoing medicines. Get your blood pressure and blood sugar levels checked at regular intervals. And stay warm to protect yourself from cold weather. And at the same time, I would warn you against the use of coal based or faulty heating appliances in closed rooms, as it may be dangerous. By following these, every one of us, and especially the vulnerable people, may be able to lower their risk of heart attack and strokes in winter. Stay healthy. Good luck.